Hello everyone, welcome to FMT Guru. We are going to discuss FMT recall question asked in INACET May 2020. There were around 9 to 10 questions asked from forensic medicine and toxicology. This is the one question asked that is about the cocaine poison. The formication or Magnan symptom is seen in. So this is asked in last INACET also, NEET PG also. The formication or the Magnan symptom is seen in. Options are cocaine, cannabis, opium, and MDMA. As you know, formication or Magnan symptom, they are also known as cocaine bugs. They are tactile hallucination. They are commonly seen in case of cocaine addiction. So your answer should be cocaine is the correct answer. Cannabis. Run amok. Run amok is the chronic manifestation of chronic cannabis poison. So B is not the answer. Opium, that is asked in one of the other question. MDMA, which is a well-known party drug. So answer is cocaine. You can see here. So this is the cannabis. This can be asked in your upcoming exam. So identify the image, that is ganja. Ganja, bhang and charas, they are all the preparations of cannabis. Some more points about, so look at this. So this is the MDMA, nothing but ecstasy, which is a well-known party drug. And this is what the cocaine. The cocaine is also known as white lady. And this is Papaver somnifera. All the four images, they are very commonly asked in your exam. So Papaver somnifera is a plant of opium. Let's discuss few points about cocaine poison, because this can be asked in your upcoming NEET PG or INACET exam. So what are the clinical features of cocaine poisoning? So as you know, there is increased levels of serotonin, increased levels of norepinephrine and epinephrine in the brain. So that can lead to all these signs and symptoms. Increased temperature, and there can be pupil dilation. Remember, miotic pupil, that is seen in case of opium poison. The pupil dilation or mydriasis, that is seen in case of cocaine poison. There can be vertigo, constriction, increased blood pressure, increased heart rate, risk of respiratory arrest, tremors. All these are the manifestation of crack cocaine, which is inhaled. This question can be asked in your upcoming exam. Here is the case, a case of sudden death. During autopsy, I found multiple packets of cocaine inside the small and large intestine. So, and patient died due to intracerebral hemorrhage. What is the diagnosis? Your answer should be body packer syndrome. This is body packers body packers syndrome. Okay. Next question. There was a question about drowning. Not a sign of antemortem drowning. My dear students, drowning is very commonly asked in your INACET exam or NEET PG exam or FMG exam. Very commonly asked. So what is not a sign of antemortem drowning? Options are diatoms in bone marrow. Diatoms in bone marrow, it is a feature of antemortem drowning. When diatoms are there in bone marrow and brain, that shows that the CVS is intact. That means the heart is beating. That means it is a case of antemortem drowning. Washerwoman hand. Yes. So this can be antemortem or it can be postmortem. Time being, remember. So fine leathery froth. Fine leathery froth is a feature of antemortem drowning. Fine leathery white froth. So that is not the answer. Adipocere formation. Adipocere formation. It is the well-known post-mortem change. So the best answer for this question is D more than B. D more than B. Adipocere formation, mummification, and putrefaction. All these are late post-mortem changes. Or some students say that, so this is the proper framing of the question. Not a sign of antemortem drowning. Options again: diatoms in bone marrow, washerwoman hand, fine leathery white froth, clenched hand with the aquatic plant. So the clenched hand with aquatic plant is one of the surest sign of antemortem drowning. If they ask you the surest sign of antemortem drowning, your answer should be that is cadaveric spasm, that is clenched hand with aquatic matter in the hand. So that is not the answer. Fine leathery froth, that is not the answer. Diatoms in bone marrow, that is one of the important sign of antemortem drowning. Washerwoman hand, that is the correct answer, because the washerwoman hand that can be seen in various conditions, it is non-specific also. The answer should be B is the correct answer. Yes. Let's talk about what are the autopsy findings in drowning. This is what we discussed in our classes. So this is fine leathery froth. You can see here balloon shape, fine leathery froth, which is present at the mouth and nostril, so which is a feature of drowning. But remember, it is a non-specific finding. It can be seen in electrocution, it can be seen in opium poison, it can be seen in OP poison. So all these are taken from the standard textbook case and ready. It appears within 2 minutes of drowning, which is a fine froth, white in color. It looks like a leathery foam at mouth and nostril. Looks like mushroom-like mass. The bubble do not collapse with the tip of the nut. It reappears on wiping. It is a non-specific finding. It can be seen in electrocution, epilepsy, opium poison, pulmonary edema, putrefaction, and strangulation. Can I name one condition in which this froth is absent in case of drowning? Your answer should be dry drowning. So dry drowning or in case of immersion syndrome. So both are the types of drowning only, and the froth is absent in that. What is the cause of death in dry drowning? That can be asked in your upcoming exam. Your answer should be that is laryngeal spasm. What is the cause of death in case of immersion syndrome? Your answer should be vasovagal inhibition because of the cold water that stimulates the vagus nerve. Next, what about this? So this is, you can see here, bleached appearance. You can see the bleached, soddened appearance. So this is nothing but washerwoman hand. What is the finding here? Soddening, bleaching, and wrinkled appearance. What is this? Can you identify this? So this is the one of the surest sign of antemortem drowning. So this is nothing but cadaveric spasm, or it is also known as cataleptic rigidity. Cataleptic rigidity. This is the surest sign of antemortem drowning. What is the surest sign of antemortem hanging? Your answer should be dribbling of saliva. What is the surest sign of antemortem bone injury? Your answer should be tooth particle present in the trachea and the bronchioles. This is the cataleptic rigidity. Look at this. What is this? This is nothing but cutis and serina. All this can be asked as an image-based question. Cutis and serina. Again, it is a non-specific finding. Look at this. This can be asked in upcoming INICET exam. In case of live conscious drowning, there are breathing efforts that leads to a condition known as emphysema aquosum. So this is emphysema aquosum. If they ask you an exam, living conscious drowning, because of the breathing efforts, there can be emphysematous lung, there can be water in the lungs. So that is emphysema aquosum. On histopathology, there will be break in the alveolar membrane. So this is seen in live conscious drowning. In case of unconscious drowning, that is live unconscious, the person is alive and but he is unconscious. In that condition, you can see something known as edema aquosis. Edema aquosa, characterized by no foam in the air passages. It contains more water, less froth because of excessive passive entry of water into the lungs. Both can be asked in your upcoming exam. The seventh important finding, that is the hemorrhages. In some cases of drowning, you can see some hemorrhages in the lower lobes of the lungs. That is known as fault of hemorrhages. What are these? Fault of hemorrhages. They are present beneath the pleura, around the 3 to 5 centimeter in diameter. Is seen up to 50% of the cases. They are commonly seen in lower lobes of the lungs. They are because of the violent breathing efforts. The last one, the very important finding, is the diatom. The study of diatom is known as forensic limonography. When diatoms are there in the bone marrow and the brain, so that is also one of the feature of antemortem drowning. And the diatoms, they have a extracellular coat of silica ions. That also can be asked in your upcoming exam. So that's it about the question number 2. Question number 3. Identify the image. So in the image, there was black charring, vesicles, blisters were there, and line of redness. Line of redness is a feature of antemortem bone injury. Vesicles can be seen in scald also. It can be seen in case of flame burn also. So black charring. So black charring, vesicles, line of redness, all this go in favor of antemortem dry heat burns. Not barbiturate poisoning. They are not scald, because in scald black charring is absent. Chemical burn caused by corrosives, vesicles are usually absent. So the better answer for this question is antemortem dry heat burn. So you can see here a reference from the standard textbook. So the dry heat, the moist heat, also known as scald, and the chemical burn. See here, dry heat, the moist heat, and the chemical burns. So in dry heat, you will see charring. You can see here a charring, the black color appearance of the skin, that is seen in case of dry heat, that is absent in case of moist heat, that may be present in case of chemical burn. One more point here, that is the vesicles. The vesicles, they are present in case of dry heat injuries. They can be present in the moist heat injuries also, but vesicles are absent in chemical burn which are caused by corrosives. So your answer should be that is the dry heat burn is the correct answer for that. Next, black food disease caused by arsenic is one of the very commonly asked heavy metal poisons. The black food disease. So in case of endemic arsenic poison, there can be peripheral vascular disease that is known as black food disease. So your answer should be arsenic is the correct answer. It is not lead, it is not mercury, it is not yellow phosphorus. Okay, so arsenic is an ideal homicidal agent. It is also known as king of all poison. So the most common source of arsenic poison is the water related. The consumption of water containing high amount of arsenic that can lead to endemic arsenic poison, that can lead to peripheral vascular disease, that is known as black food disease. So arsenic very commonly asked in exam. Remember, there is a mnemonic for the arsenic poison signs and symptom. The mnemonic is Bonaparte RRR. B for black food disease. This is again INSET question. Okay. O for, that is oxide. Arsenic trioxide, it is one of the common compound of arsenic, which is colorless, tasteless, odorless compound. It can be mixed with any food and drink. So that is oxide. And the fatal dosage, again it is a repeat question in INSET, around 120 to 200 milligram, so or 2 mg per kg body weight. And what is the smell of arsenic poison and opening the cavities? Garlic smell. So garlic smell also can be seen in case of phosphorus poison also. N for neoplasia can lead to skin cancer, lung cancer, and a bladder cancer. It can cause Aldrich lines over the nails and the hair. Last NEET PG exam, there was a question about Aldrich mist line. Aldrich mist line also can be seen in case of thallium poison. A for, that is alopecia. A for anemia, Addison's like disease. It can be used as aphrodisiac, abortion stick, apoptosis. It induces apoptosis. Peripheral neuropathy, it is again an INSET question. Arsenic causes mixed neuropathy. Lead causes motor neuropathy. So there can be more involvement of sensory than the motor in case of arsenic poison. There can be distal muscle weakness. What is that known as? Chlorine stalking, that is neuropathy. There can be inhibition of pyruvate dehydrogenase enzyme. Aldrich mist line. Aldrich mist line, remember, can be seen in case of thallium poison. That is about the mnemonic. Some more point here, some more images you can see here. The image number 1 that shows the black food disease. The image number 2 that shows arsenic trioxide. The image number 3 that shows the Aldrich mist line. And there can be other preparations of arsenic. They are known as Chilis green and Paris green. So Chilis green and Paris green, they are preparation of arsenic along with the copper. All the 5 that can be asked as a image based question. So some more entrance point are for rigor mortis lasts longer. It retards putrefaction. Arsenic retards putrefaction. That is also repeat question. Teratogen. Enteritis. Arsenic causes enteritis. It causes rice watery stool. It resembles like cholera. So cholera resembling poison. Your answer should be arsenic. There can be question about metal fume fever that is caused by zinc and other metals. Endocardial hemorrhages. Okay. R for raindrop pigmentation. One of the very commonly asked in the exam. The raindrop pigmentation is very commonly asked in the exam. Please try to remember. Measles rash, that is also seen in case of arsenic poison. Red velvety stomach, that is also seen in arsenic poison because of the hemorrhagic gastroenteritis. And one more R here, triple R is the mnemonic. R for rinse test, Marsh test, Gritchie test, neutron activation analysis. All these are the tests for the arsenic poison. Fatal dosage, so already we discussed fatal dosage and 120 to 200 milligram. Diagnosis by neutron activation analysis. What is the drug of choice? The drug of choice is British anti-levisite. The treatment is British anti-levisite, which is given intramuscularly. It is not given intravenously because it contains peanut oil, which can lead to fat embolism. The dosage 3 to 5 milligram per kg body weight every 4 hours for about 7 to 10 days. or else you can start with the DMSA, DMPA, penicillamine also. All this can be asked in your upcoming exams. Yes, now some more pictures here, some more image based question. What is this? And what is this? What about this? Okay, so the image number one that shows the raindrop pigmentation. The image number two that shows red velvety stomach. And the garlic odor we discussed, garlic smell is seen in case of arsenic poison. And erythromelalgia that is also finding in arsenic poison. And here the one agent that is the drug of choice, that is your ball is the correct. The British anti-leviside, that is the drug of choice in case of arsenic poison. So that is not given in case of iron and cadmium poison. Now question number 5, it was about the delusion. A belief that one has lost organs, blood and the body parts to insisting that one has lost one's soul or is dead. Tells that I am already dead, my brain is missing. So this is some a type of delusion that can be seen in case of depression. What is the delusion known as? Very simple. It is not erotomania. What is erotomania? Erotomania, in simple word, is known as delusion of love that is common in females. Delusion of preference, no, not related to delusion of preference. Delusion of persecution, no, it is not delusion of persecution. It is known as nihilistic delusion, is also known as Cotard syndrome. Cotard syndrome. Where it is seen? It is seen in case of depression. It is seen in case of depression. Next, question number 6. Identify the finding given in the image. You can see here image. In this image, what you can see here, there is a postmortem change. There is a late postmortem change. There is a late postmortem change. And the postmortem change is white in color. And it commonly occur over the fatty tissues. So fatty tissues. What is the best answer? Your answer should be Adipocere formation. Answer is A is the correct answer. Adipocere, mummification and putrefaction all are the late postmortem. So the mummification, the color is the black color. Adipocere, the color is the white color. And the putrefaction, the usual color is black or it is green in color. Postmortem hypostasis, no. Postmortem hypostasis commonly seen in the dependent body part. So that is not the answer. Rigor mortis is the shortening and stiffening of the joint. That is because of ATP depletion. That is not the answer. Mummification is not the answer. Your answer should be adipocere form. Antidote for morphine overdosage. The question was about morphine overdosage. Very simple. So morphine overdosage, we normally give naloxone. The methadone is given in opium addiction. Pethidine itself opium. Atropine is given in case of opiate poison. Your answer should be naloxone, naltrexone. All these are the antidotes that are useful in case of morphine overdosage or heroin overdosage. So what are the signs and symptoms of morphine poison? The mnemonic is morphine. So morphine. What is the M for? Meiosis. Meiosis seen in case of opium poison. Mydriasis seen in case of datura poison. In cocaine poison, again there is a pupil dilation. There can be orthostatic hypotension, respiratory depression. So the question can be asked in the exam. What is the triad of opium poison? Your answer should be coma, respiratory depression, and the meiotic pupil. There can be pain suppression, histamine release, increased intracranial tension, nausea, euphoria, and sedation. All this because of action of opium over the opium receptors. So now look at this. This is also question asked in the exam That was also about the opium poison. A 20-year-old woman brought to emergency department by the police due to being found unresponsive. So there is a coma, there is a coma, there is a respiratory depression. You can see the respiratory rate is 6 per minute, and also there is a meiosis. Meiosis. So it is the triad of what? The triad of opium poison. Opium poison. So what is the agent that is used? That is the naloxone. That is. So next. Question number 9. There was a question about scorpion bite. This question was asked in INSET 2020 also. So there was a scenario, something related to a grandmother and a child. Okay, so same type of question asked in INSET 2021. You can see here the patient is having pain, priapism more than 7 hours. So priapism more than 7 hours. Priapism is there. Priapism, pain, and you can see the sweating. You can see the sweating. You can see the low BP, and you can see the increased heart rate. All this go in favor of the release of catecholamines from the adrenal gland because of scorpion venom. The scorpion venom acts on the adrenal gland that causes release of catecholamines. All this leads to all these signs. And what is the antidote? Your answer should be prazosin is the correct. So the prazosin is the correct answer. That is the best answer. It is not methylprednisolone. It is not adrenaline. It is prazosin, correct answer. It is not ASV. It is not anti-snake venom. ASV means anti-snake venom. It is not the answer. So let's discuss few points about scorpion. So scorpion, the scientific name is Mesobutus stamulus. It can be cardiotoxic. It can be neurotoxic also. It can be hemotoxic also. Lead to signs and symptoms like viper bite. Toxicity is more than snakes, but death is very rare. It acts on adrenal gland, causes release of catecholamines. That's why prazosin is given. Other treatment aspects, xylocaine, that is for the pain, calcium gluconate, barbiturate, and atropine. Atropine basically for pulmonary edema. The drug of choice, your answer should be that is scorpion anti-venom. Last question. So SRY gene. SRY gene is a very simple question. So what is the answer for SRY gene situated at? It is the distal region of short arm of Y chromosome. It's very simple. This is one question asked from identification. So if you have any doubt, or if you have any doubt related to question and the option, you can message me in the chat box, the YouTube chat box. And thank you. To all the best for upcoming exams.